Hey everyone, I'm Jess, exercise physiologist, and this is Sam, physio from Physio Essentials. So we're going to show you some functional tasks that you can modify during your time of pregnancy. Standing up out of a chair is quite a functional task that can be modified in the way that you need to make sure that your feet are hip width apart, your knees are directly in line with your toes or your feet. When you're standing up, you need to squeeze through your bottom muscles and you need to breathe out before you stand up and continue to breathe out once you completely stand up. So Sam, please squeeze through your glutes, breathing out and stand up. Very good. Then when you sit down, make sure your feet are in the same position, okay? Your knees do not come in together as if they're knock knees, and you're going to sit down in the chair, breathing in. Very good. Make sure you're not holding your breath during this exercise. We don't want to have what we call a Valsalva maneuver, where you hold your breath, as that places an increased pressure on your pelvic floor and within your abdominal kind of stuff.
Alrighty, so another activity that we can modify is lifting something off the ground. So for example, we're going to use the roller as an example today to mimic a small child. So what we're going to do, there's two ways that we can practice lifting. The first one is a lunging down. So Jess, I want you to step one foot right next to the roller and the other foot a little bit further back. We're going to slowly lunge down, bringing the back knee down to the ground. You want to pop your hands around the roller, push through the front foot and squeeze your bottom as you stand up. Good, and then bringing those feet together. Beautiful, so that's the first way. The second way that we're going to show you is a hip hinge. So this time you want your feet hip width apart. You're going to slowly bend your knees as you go down, and as you do that you want to stick your bottom back as if you're trying to touch whatever's behind you with your bottom. From there, keeping that back straight, you're going to bring that roller to your chest and push through your heels as you stand up, bringing those hips forwards. Perfect.
A task which may need modification is standing up when you're playing with your children on the floor. So what you're going to do, Sam, is get into a position where you're 4-point kneeling with your hands on the floor and your knees on the floor. Wonderful. Now from here you're going to come up into a kneeling position and then into a half kneel where your one foot is in front of you into, very good. Okay, so this is your half kneel position. Now to go into a lunge, you're going to push through your front heel, okay, and squeeze your glutes, breathing out and stand up. Okay, so getting onto the ground. Obviously, if you need assistance with something, please hold on to something close to you. But we're going to go firstly into a lunge position where you are bringing your one leg behind you and you're going to bring your knee down to the ground. Well done. Okay. Now you're going to go into a kneeling position. Very good. Then into a 4-point kneel with your hands on the ground. You can sit back onto your feet and bring your feet together in front of you, either like this or into a normal sitting position on the floor.
So one of the functional tasks we're going to look to modify today is getting out of bed. It's really important in the later stages of pregnancy. Many obstetricians say to try and avoid sitting up or doing crunches through the abdominal area. So we're going to show you how we can modify this task. So Jess is going to straighten her right arm out for me. Yep, and keeping those knees and ankles together. Beautiful. We're going to slowly roll onto our right side, making sure that our shoulders and hips roll at the same time. So we're going to roll over. Beautiful. From here you can use your right arm. You're going to slowly push up, but at the same time you want to drop your feet over the edge of the bed. So we want to slowly drop our feet over and lift, pushing through the arms. Beautiful. And sitting up nice and tall. So we want to make sure we keep our knees and feet together the entire time, and we're rolling over to one side in one motion. So another modification we're going to look at is getting out of the car. A lot of women, some women experience pubic symphysis pain or pain in the front of your hips, and it's really painful when you're trying to get out of the car because you need to move one leg and then the other. So a nice modification for this is keeping your knees and feet together. You're going to pop your hands either side, Jess, and we're just going to literally spin in the seat, bringing both feet and knees together out of the car. So you're going to spin, beautiful, and then once you're out of the car, keeping those feet nice and close, you can stand up and get out of the car. Beautiful. Alrighty, so another activity that we can modify is when you're washing the dishes or putting the dishes away, in order to get those glutes working and offload the lower back a little bit. So a nice way to do it is, Jess, I'm going to get you to open the door underneath. Yep. Perfect, and there's a little ledge from the shelf. So what you want to do is, for example, if Jess is cleaning up, she's just going to stand with one foot on the ledge. Yep, perfect. What that does is keep that back nice and straight. You want to pop the weight through the back heel and get that bottom muscle firing. So it's kind of like balancing on one leg, but a little bit safer, especially when you're handling things throughout the kitchen.